Hello, I'm Michael Reddy, Dean of the School of Dentistry at UCSF, and welcome to the first edition of Under the Microscope, a new series in which our amazing UCSF alums share their perspectives on trending topics in health and science. I'm thrilled to kick off Under the Microscope with a topic that's top of mind for UCSF and its alums, the future of healthcare. Advances in technology and data science continue to shape the healthcare landscape on how we detect, diagnose, treat, and prevent disease. Across the practices, we've seen profound impact and tremendous potential of tools like digital imaging, artificial intelligence, genomic sequencing, machine learning, and other technologies. Our guest today has fully embraced a tech-forward approach to advancing the field of orthodontics. Dr. Jan Kalika, who completed his orthodontic training at UCSF in 2001, is a board-certified specialist in orthodontics and dental facial orthopedics. He received his dental degree from Harvard School of Dental Medicine and attended UCSF for his orthodontic residency and a master's degree in oral biology. Dr. Kalika is also an entrepreneur. He is a co-founder and board member of several companies and serves as a consultant to Align Technologies, the creator of Invisalign retainer-based tooth movement. Welcome, Jan, and thanks for being here.
No, thank you very much for having me. It's a pleasure to be part of UCSF journey.
Well, we're excited that you joined us today. And, before we jump into our discussion of the future, I'd like to ask you to look back at your time at UCSF and how did attending UCSF support your aspirations and help your career development?
Well, obviously UCSF was in the middle of Silicon Valley. And the interesting thing for me is, when I was a resident, I was able to work at Invisalign, which was then a startup company. And the fact that I'm in Silicon Valley in the middle of this epicenter of technology and innovation, and here it is that the aligner company that is actually, so innovative that we've never heard of. A lot of people had a hard time adapting that Invisalign will ever become something that's different than wires and bands. So the fact that I was able to kind of combine my UCSF schooling with working at Invisalign really gave me a cutting edge into the startup world, technology, and I looked at people, how they raise money, how they innovate, and it was really very helpful. Although I had to work at nights at Invisalign after my regular day, it was well worth it. In addition, it enriched my orthodontic, education in return because, I was doing like 50 to 60 orthodontic setups a day. And after a while, it was like a game. I could see teeth moving at night and, having a little bit of a chess background, for me, it was like chess pieces. I would have dreams about how to set up a case in like 2 minutes. So it was very interesting. The combination of UCSF and being here and, the technology and companies and having a lot of friends who are in the startup world really shaped my experience going forward.
Wow. So I'm fascinated by your thoughts of like thinking 3 steps ahead or more in a chess game and how that relates to orthodontics and tooth movement. Today, orthodontic retainers are the most common 3D printed medical device. Personally, I didn't see that coming. So was that a surprise to you when you were in orthodontics residency at UCSF and working on these technologies at night?
Yeah, I didn't expect that the scope that Invisalign is going to get that big. Otherwise, the smartest thing I could have done is held on to my stock, which I sold a little bit too early. I would have been much happier now if I anticipated such a huge growth. But it's great to see that the fact that we're part of the development journey and the early stage of the company, and the company is so successful. It's always good to be in some way associated with a success story.
It's always better to be part of a success. So, you are a big advocate of technology in the field of orthodontics and healthcare innovation overall. So what currently excites you?
Well, the biggest thing, there are few different areas that excite me in dentistry. One of the areas is artificial intelligence. I think that, there's a few companies, one of which I was involved in called DiagnaCat, that uses 3D imaging to analyze and diagnose not only the teeth, but neighboring structures and airways, TMJ. And I think if we think and draw a parallel again, because I'm from a chess world, at some point the computer is going to is going to beat any kind of chess champion, right? Even though our brain has an unlimited capacity, the fact that there's supercomputers out there that will be able to diagnose dentistry. So artificial intelligence will be an assisting tool for dentists to be able to diagnose better and prevent the disease and treat better. The second portion is the sensor technology and analytics of the breath. I think that, I was on the board of a company, and I'm still am, of a company called Breathometer that actually analyzes the breath, not only for gram-negative bacteria, which is a predictor of periodontitis, but also for like ketones, which can show you if you're losing weight or gaining weight, and some of the markers that could show you lung cancer. So analytics of the breath using sensors, and in general, having sensors in the oral cavity will really give us a huge thing. And the other area, or maybe two, that I'm excited about is now all of the innovations in airways. We're finding out that, when we treat airways, we reduce inflammation in the body, which I believe leads to a lot of neurodegenerative disorders and disorders of the facial pain and orofacial pain. So if we're going to learn, and I think we're in the best position from the oral cavity side how to treat inflammation, that would be fantastic. And the last but not the least is the biogenome. So we'll be able to genetically understand what kind of composition and predict some of the genetic markers in different things. So those four areas, I think, in the next 10 years are going to innovate dentistry.
Wow, you just gave us a lot there of how dentistry relates to overall health, and that's a big aspect of what we're concerned about at UCSF. Let me go back and take this apart just a little bit, and let's start with artificial intelligence and back to the chess world of how that could be used to not only help the practitioner make a diagnosis, but to benefit the patient.
Yeah, so artificial intelligence, which I use in my practice, is totally changed my world in the last year. Basically, what I do is when the patient comes in, the flow is I take a 3D scan, and it creates a panoramic transformation, which is a two-dimensional image of the 3D scan using mathematical formula. And then it uses like 16 different neural networks that analyzes each tooth and creates different sections. And it's a pixel perfect, because we annotated all those teeth. It's a pixel perfect representation of each tooth. So if there's any kind of intrusion, which is caries or any kind of bone loss, the software detects it and points me in the right direction. And sometimes I communicate with general dentists and I'm showing them, look, there's a little cyst here in 3 dimensions that you've never been able to see. Because now you can see a 3-dimensional structure of something, of a subject that we've never been able to see. So, we don't know what we don't know, and a lot of things we didn't know what's happening under the gums. So now my eyes are wide open, and I think AI is shaping that. Also, when I diagnose people, I treat by the airways, and I'm able to see the airways and segment it in 2 minutes. The artificial intelligence software segments the airways and the TMJ, and I could see the anatomical structures and see, how big the area of the airways is, and where the pressure points of the TMJ, and I'm able to get more information and put it together to come up with proper diagnosis.
Yeah. So the air, that's great. The airway is another interesting aspect. Do you think before, when we didn't use much three-dimensional imaging, do you think that, when we were examining patients' head and necks and dentistry, were we missing airway problems that could be important, or we're
Absolutely.
just unaware? Yeah.
Absolutely. I think that airway, luckily for me, and that's my kind of a lucky ticket being at UCSF. I had great teachers that were mostly European origin who really paid a lot of attention to airways. And the classic study on airways was done in UCSF using primates by Harvard and Vargovic. And Dr. Vargovic was the chairman of our department when I was there. And Dr. Nielsen and everybody really opened up our eyes about facial development and craniofacial growth and how important, is breathing properly and the airway and how they affect the jaw growth. So that's part of UCSF that I feel gave me so much training that other residencies didn't even offer. And so when I came out of residency, I always looked at that, I didn't have the three-dimensional view, but at least I had 2D representation and thinking about how do I have the kid breathe better and what can I do orthodontically to execute it. So that was very enlightening, and that was my learning experience in the UCSF that really put me on that journey.
Yeah, that's great. Well, it's great that you got off to such a great start. So you talked about something that's, of a great interest to me, and that's, inflammatory mediators, analyzing breath for trace element analysis and other aspects. Can you talk a little bit, you're talking about like a whole new concept of what it means to have bad breath. Can you talk a little bit about that for us?
Yeah, absolutely. So, we never really analyzed the breath, except this. I remember when I was at Harvard, there was the Foresight Institute developed this huge machine called halimeter that really you analyze your breath, but it was like it occupied the whole size of the room, and then you would come in and breathe into it, and all those different reactions would analyze, whether you have a lot of gram-negative bacteria, which then, you can measure the sulfur level and it will tell you whether you have bad breath. But, right now we know gram-negative bacteria is predictor for periodontitis, which is really an active inflammation. And the same bacteria in the mouth is found in Alzheimer patients. So we can, I believe inflammation is a precursor to so many things, including pain, including cancers, including some of the neurodegenerative disorders like Alzheimer's and Parkinson's. And I think that by analyzing the breath, for example, what we did at Breathometer, we created a medical device that's very small. It would go in the mouth, you would press the button, and it used the fan to analyze the air from the mouth, so you don't get the sample of the lung air, and basically had an application on the phone, and right away it will tell you, where your gram-negative bacteria is, and if it's too high, you need to go brush and floss, and hopefully you can control it this way. So it's an active measurement of where people need to be and how they need to control their oral health. And so I think that's just the beginning for us to understand, all this part of the airway, including breath and and the genomic factors.
Yeah, it's fascinating. And, the interaction between someone's oral health and their overall health and how that dentistry can contribute further, I think is just going to grow. You've talked about some of the things you've been working on, and it's fascinating to see someone who, is a busy orthodontist running multiple dental practices. And I'm curious, what led you to get involved with so many startups and tech companies?
I think probably part of my human nature is that I want to always learn more. And I'm actually down to I work in one practice clinically, and I'm concentrating more now on clinical practice because with AI, there's so many things that I feel I can do for my patients. But, I think the part of me maybe has an inquisitive mind, and I always want to learn different things. And, after 20 years practicing orthodontics, I felt like the learning curve is not, I've seen a lot of things. I've been on a lecture circuit for 3 years.
Yeah.
I've listened to everybody who is like experts in the world. I felt like there's really not a lot of growth in that area. So for me to really contribute to, healthcare and oral healthcare in particular, I had to get involved and really learn some of the innovative things. And I don't regret it. I feel like it really enriches my experience and how I look at the health aspect and the orthodontics and how dentistry is connected to the whole overall health.
Okay. Yeah, that's just fascinating. So how do you want to practice in the future, and what are you doing now to support where you're going? You talked a little bit about that, and where do you think we should be going at UCSF overall for healthcare, but specifically for dentistry?
Yeah, so for me, practicing in the future means that incorporating all this latest innovations, right? And my practice has changed. Like I said, I do some of the airway orthodontic procedures that I started doing fairly early, like maxillary expansion with the mini screws, or some of the airway calculations in 3 dimensions. I think that what I'd like to do is use all of this knowledge and kind of have a digital patient. That's my vision of the future, is that somebody is going to come in, they're going to get a 3-dimensional scan, an intraoral scan, the photos, and we'll put it all together and it creates this digital patient, which we are already doing in our AI software. And then based on the digital patient, we have this multidisciplinary tool with a messenger where everybody can have this patient almost as a project, and different specialists and general dentists can collaborate and have all of the records centralized in this digital platform, which, we created that kind of scenario. Now we're doing it for Seattle Study Club on the AgnaCat side. And then this digital patient becomes collaboration tool. Everybody contributes and know where everybody is, and there's transparency. And it starts with dentistry, but it really integrates into medicine, right? And we understand, okay, this patient has allergies. Okay, why are the allergies? Is it a symptom, or is it the natural cause? Maybe if we take care of the airways and convert them to nose breathing, they won't have allergies anymore, instead of getting Ritalin for the kids. And so I think that this integration of dentistry with medicine and working not just with dental providers, but with neurologists, with the ENT surgeons, with psychologists, with pain medicine for people. I think that's where I see, and I would love to be part of this future. And I think UCSF is really well positioned to do that now that, you have spent a lot of time becoming part of UCSF Health. It should be very exciting for everybody who understands where you're going. I believe that integration with the healthcare and being able to be part of overall system is almost making a circle in dentistry, right? When dentistry got separated, and now it's getting back into the medical arena, and we're part of the whole picture.
Yeah, well, that's fascinating, and I love the way you're thinking about the interoperability of the data, putting the data together. I think that's one of the things, as data is powerful, but it's only really powerful when we connect it, when we have systems that talk to each other and integrate with them. And I think that's a vital way of building healthcare. So I wanted to ask you, traditionally, dentists have practiced alone. We've talked a little bit about how we want to integrate into health. More and more dentists are working in groups. And at UCSF, we're training dentists to work collaboratively with their colleagues in medicine, pharmacy, and nursing. So if we talked again next year, or maybe more likely 10 or 20 years from now, what would the healthcare environment look like?
I don't know if we're asking about particularly UCSF, but I think what I described just now, I think, I could see UCSF I would like to see UCSF being part of the first AI dental schools. I mean, it would be fantastic to be able to teach students the future and where we're going. There's already 3, 4, 5 startups of AI in the world 4 of them in Colorado. I mean, 4 of them are in the United States. And I think that, you know, being able to learn this and being on a kind of cutting edge of technology, you know, will put UCSF Dental School at the leadership position that it always had with NIH funding and ability to interact with the medical community. So again, I feel like 10 years from now, we're going to have this telemedicine situation where we're going to have, you know, the super phone or the computer, you know, patient is going to get all those, you know, images. AI is going to tell us this is what the patient needs, and that's the sequence. And, you know, our role is going to be able to navigate them and properly assign them to the right practitioner. And I feel like, you know, that interdisciplinary work between dentistry and medicine and pharmacy is going to be at your hands, like on your device, or maybe even voice control, where, you know, the patient is going to get the plan of the future that really makes sense.
Wow, and that's a fantastic vision for the future, and I think it's one that we certainly need to create here at UCSF. You know, I want to thank you for a great discussion and sharing your views of the future of healthcare. And to all of you who have tuned in to the first edition of Under the Microscope, thanks for listening and be well. Take care.
Thank you, Jim, and thanks for having me. I appreciate it very much. And I think what you guys are doing for dental school now is amazing. And I'm excited to be a part of the journey to help navigate it with you. So thanks very much.
Thank you. Bye-bye.
Take care. Bye-bye.